Great. Thank you, Savannah, for that wonderful introduction. My name is Dr. Arthur Mark. I've been with Seaview Orthopedics now for almost 21 years. Looking at the list of participants, I see some familiar names, so I'm glad that I got some of my patients to come join us today. Um, I'm going to just go over this brief talk, and then there'll be plenty of time for question and answers at the end. Feel free to either put it in the chat box for later, or we can wait when it gets further along towards the end. So, Savannah, can you give me controls to change the slides?
Yep, give me one moment. Sorry about
Thank you.
that.
No problem.
Let's see.
Right. So we're going to talk broadly about winter joint pain. It's more of really the question I get asked all the time in the office is, why do my joints hurt more or less depending on how the weather is outside? I feel like I'm a barometer all the time, and there is some science to this. So we'll go over some of the things that can happen and how we can make it a little better for ourselves. One of the common things is, why do we have pain in the wintertime? There's a couple things. Number one, when it gets cold and damp out, you actually get some physical changes that happen to your bodies. First of all, the cold wants to preserve your body heat. So your body constricts the blood vessels to your extremities, mostly your hands, your feet, the knees and the hips and the elbows and the hands. And they want to bring the blood supply to your head and to your core body. So bringing this blood to your core body makes it a little harder for your hands and your joints to get circulation really well. In addition, the dry air from the wintertime can also lead to dehydration, and the dehydration causes some problems with your joints. If you don't drink enough water, the synovial fluid gets thick, you don't feel well, and everything just does not feel great. The other thing is that the synovial fluid, the lubrication that you find in your joints, actually gets a little thicker when it's cold out. So when your blood vessels constrict in your extremities, they might not get as much warmth, and the synovial fluid gets thicker and can lead to more discomfort and stiffness. Other things, why does my body feel bad in the cold weather? Well, when it snows or rains, there's actually a decrease in the barometric pressure. So the air pressure around you actually goes down. And if the air pressure goes down, then your joints actually swell because there's not as much pressure pushing on it. And when the joints swell, it actually causes physical discomfort if you have any type of arthritis. That will make your joints feel stiffer and more painful. Also in the wintertime, we tend to be a little bit more sedentary, whether we like it or not. The cold weather keeps us inside, and we don't go outside and take our walks or exercise as much as we want to. It leads to sometimes increased weight, which gives you more stress on your joints, and it also can weaken your muscles. And that's why it's very important to stay active and do physical activity all the time. We really don't want to sit around and become a couch potato. The other thing indirectly is that we have less sunlight in the winter and we tend to spend more time inside, so you don't get as much sunlight. Sunlight is very important for vitamin D. Um, you need the sunlight to convert the vitamin D from an inactive form to an active form. And we all know vitamin D and calcium is very important to bone health. And vitamin D levels also are important on regulating your inflammation. If you do not have enough vitamin D, you tend to have more inflammation, which causes your joints to hurt more. So what can we do to make it a little bit better for this winter joint pain? You can dress in layers to keep warm, use compression gloves. These are all things that you can try to push the circulation better to your hands and your limbs. Heating pads are great and keep your joints warm. These are all very important things we could do to make our joints feel better in the wintertime. And then it comes to probably the most important part, which is to exercise. I can't tell you how important it is to stay active. The more you use your joints, the better the circulation is, the less your arthritis actually hurts. People think that once you get arthritis, that if you sit around all the time, it will make your joints feel better, but it's actually the worst. If you don't keep your joints limber, they become more painful. Also, exercise is important to keep your weight down. And you can do this indoors, even if it's cold out. And then back in the beginning, we talked about hydrating. If you are dehydrated and the air is dry around you, you're not going to feel well. So remember to drink a lot of water and a lot of fluids in the wintertime, and that will make your joints feel better. So what can we do about it now that we have a little bit more joint pain in the wintertime? Besides getting up and exercising and staying warm, there are things that you can do also. I think one of the best things that we can talk about are the medications you can take. I think the mainstay of treatment for most people with early arthritis are anti-inflammatories or NSAIDs. The two most common are ibuprofen and naproxen. They both really work well. The downside is if you take too much, it can hurt your belly and cause gastric ulcers. And it's also not so good for your kidney and your heart. So if you have bad kidneys or a really bad heart, you should talk to your doctor before starting these medications on a daily basis. If you have a bad day or two, I think it's reasonable to take it. But if you start taking this medication every day, you should talk to your primary care doctor. The other group of medications is Tylenol. Tylenol is also called acetaminophen, great pain medication. Again, much safer if you have a weak stomach or a bad kidney or bad hearts. The downside is if you take too much, it can injure your kidneys. So if you have any liver. If you have any liver issues, don't take too much Tylenol. And we really should limit it to no more than 3,000 milligrams a day. So it's very important when you take your Tylenol to look at the milligrams. It can be anywhere from 350 milligrams all the way to 700 some milligrams per tablet. So just be careful and look at the bottle. Other things people ask me all the time in the office is what we call nutraceuticals. They are medications that occur naturally. There's a big fad right now. Everybody wants to take turmeric. And I think turmeric is a natural anti-inflammatory. But again, you have to be careful because it will thin your blood a little bit. But turmeric is a good medication to decrease your inflammation. And then for many years, everybody has been talking about glucosamine and chondroitin sulfate. Some people call it MSM. There's many formulations you can get in the health food stores and in the supermarket. Again, are they really building your cartilage? Probably not. But they do act like an anti-inflammatory, similar to the NSAIDs. And if they do provide you some relief, I think it's relatively safe to take it in low quantities. But if they don't help you, don't waste your money on it because it doesn't work for everybody. The other real important thing is fall prevention. As it gets cold outside, we all know about the ice and the slippery conditions. Unfortunately, being the orthopedic doctors, we see way too many fractures. Worst case scenario, if you slip and fall and break your hip, that can be devastating. But more commonly, people break their shoulders, their wrists, ankles. These are all very preventable things. So be very careful. Please clean your walkways and your driveways. Be careful shoveling snow. Besides, taking good care of doing lifting practices. You know, after the first snowstorm, we get a lot of people with back pain and sore shoulders. So be careful when you're shoveling snow. If you don't have a good back or a good shoulder, it might be better to just hire one of the kids around the street. Also, it's important to have good shoes. Make sure you don't slip and fall. And then if you need to, using canes and walkers as support to prevent falls is very important. So what can we do at Seaview Orthopedics to help you if you have some of these problems? Well, one of the things we talked about, if you're not so good about doing the exercise on your own or don't know where you can start, we can talk about physical therapy. Seaview Orthopedic has physical therapy in all our locations, and you can come in and talk to one of the doctors and we can prescribe you a good program to help you. The things we can do are getting a quick start in stretching, exercise, and pain relief. Things they can also do at physical therapy, which you might not be able to do at home, is do things like electrical stimulation or TENS. They can do heat and cold massage therapy. And we also have acupuncture in a lot of our offices. Acupuncture can help with circulation, it can help with pain, and these can be modalities that you can do that's outside of what you would think seeing your normal orthopedic doctor. The other thing I do a lot for knees and sometimes hips are injections. Cortisone injections to me still is the forefront of what we do for most people with early arthritis. It's a great option. It's not as damaging to your joints as most people say. You can get it repetitively done every 3 to 4 months as long as it helps you. Cortisone injections can be done in our office. We can do it ultrasound guided or fluoroscopic guided, depending on what joint it can be. The other common question I get in specifics to knee arthritis is viscosupplementation, which is the long name for the gel shots or lubrication shots or rooster comb injections. They're really only indicated for knees, and insurance does cover it for knee arthritis. Typically, they can be given in 3 shots or single shot formulations. They go by trade names such as Synvisc, Orthovisc, Euflexa, Gelson, Suparts, Gel 1, Monovisc, Durolene, and Synvisc 1. So all these things are available to you, and it's good to come in and talk to your orthopedic surgeon to see if any of these interventions are an option for you. And last but not least are surgical options. My specialties are total joint replacements, mostly in the hip and knee. If your knee arthritis is really bad, then I think a knee and a hip replacement could be really good options for you. I also have a number of partners that specialize in doing total shoulder replacements. We can do special procedures in the hand and in the elbow for arthritis also. People with bad backs can get epidural injections. These are all available at Seaview Orthopedics. And then, of course, the worst case scenario is fracture care. God forbid you do take a slip and fall and you hurt your hip or your wrist or break a bone in your body, such as the ankle. Seaview Orthopedics is always available to help you. We are staffing all the local emergency rooms at Monmouth Medical Center, Jersey Shore, and Ocean Medical Center. If you come in with any broken bones, just ask for Seaview Orthopedics. We always have a doctor and physician assistant available at all times to help you. So thank you. We try to keep the talk short and sweet, but I'm here to answer any questions you would possibly have about orthopedics, pain in the wintertime, or just general arthritic pain or joint replacements.
Thank you, Dr. Mark. I do believe we have one question in the chat. So everybody, if anyone feels comfortable unmuting and they want to ask their question, go ahead. Otherwise, you can type it in the chat. It's going to be on the bottom right corner of your screen.
So the first chat message I see here is from Regina, and it says, is turmeric, I don't know what the other thing is, but turmeric is a natural herb. Most people think it is a anti-inflammatory. So any form of turmeric that you get within reason uh, will help you with your anti-inflammatory. You know, it is an herb. There are a lot of turmeric supplements. Unfortunately, because they are considered nutraceuticals, they're not really regulated by the FDA. I've seen a few patients that took too much and got themselves in trouble. But if you do what the bottle says, I think it's a good anti-inflammatory, especially if your stomach doesn't do well with traditional, Motrin or Advil. Any other questions?
We just got one more from Linda. Is it best to get cortisone or gel shots?
Um, Cortisone, I mean, my personal preference in my practice, I feel that cortisone shots work a little bit faster and they work a little bit more predictable. People with worse arthritis, with near bone on bone arthritis, do well with cortisone shots. People that have earlier arthritis or want something to help their knees before it gets too bad, their gel shots can be an option. So it's something you can talk about with your doctor. Typically, the viscosupplementation or gel shots, which is hyaluronic acid, takes about 2 to 3 weeks to work. So they don't work right away. Cortisone works pretty quickly within 2 to 3 days. If you're a bad diabetic, cortisone can spike your blood sugar levels. So some people prefer gel shots instead of that. What's the other chat message was glucosamine, collagen. I've never heard of collagen. If you're talking about collagen, I don't think that really works There are some people that believe if you eat cartilage, I know in Chinese tradition, if you eat cartilage, it's supposed to help your cartilage. I don't think there's much solid science to that. And I think if you meant collagen with an O, that's what they think, that if you eat cartilage or collagen, it will get into your bloodstream and go to your joints. I don't think that really works. We also have another question about PRP and stem cells. So PRP and stem cells have been pretty popular out there. Seaview Orthopedics does offer PRP and stem cells. For hip and knee arthritis, I think it has a very limited role. My personal opinion, I don't think stem cells work very well for arthritis. PRP can give you some temporary relief, but PRP, which is platelet-rich plasma, is when they take blood out of your body, spin it down, and put in the platelet-rich layer back in. And those cells cause an inflammation response. So they can help you with healing. I think it works better with tendonitis and maybe some tears in your muscles. I think the PRP is very helpful for that. Stem cells is still very early on. Some people claim it helps, but it can be expensive. None of these things are covered by insurance. But I would recommend that you come in and talk to your doctor about that. Next question is, do you recommend vitamin D and calcium supplements? I do think vitamin D and calcium are great for restoring your bone health, especially if you're in a high risk category. That's typically if you're a female, postmenopausal, if you're not too heavy, Caucasian, they are higher risk for osteoporosis. If you got your bone density and says you're getting low, then I think vitamin D and calcium supplements are important. But weight training exercises is just as important as the vitamin D and calcium.
I have one that was sent over to me here. It says, how safe is it to have multiple epidural steroid injections and does it affect blood sugars?
Good question. Epidural steroid injections are relatively safe. It depends how you want to space them out, depending on how much relief you get. If you get no relief, you shouldn't do them. But if you get good relief, you can space them out every couple months. Any kind of cortisone injection has the potential to spike your blood sugars temporarily. Typically, it only goes up for 12 hours or so. I tell my patients to ignore it. If you're somebody that checks their blood sugars quite regularly, I say ignore it for the first 12 hours after your shot. And the little bit of cortisone that leaks into your bloodstream does cause some fluctuations in your sugars, but that doesn't happen with everybody. That only happens to certain people.
The
I
next
have another question on chat. After you get cortisones, is that knee hurt due to the needle? Actually, the shot itself, for at least the hips and the knees and the shoulders, are not too painful. It's not the needle that gives you the pain. We also give it with some numbing medication, so your knee or shoulder will be numbed up for about 4 to 6 hours after your injection. It's after the numbing medication wears off, some people get more pain. And some people get a steroid flare, which is like PRP, will cause more pain before it actually works because it's trying to block the inflammation. And sometimes the inflammation gets a little more before it gets less. And that typically happens the night of the injection or the following day or two. That doesn't happen to everybody, but sometimes people get a steroid flare. But usually the shot itself doesn't hurt too much. Another chat question is, after surgery, at what point can heat be used? We know that ice is for swelling and heat is for pain when no swelling is present. That's a very good question. In my practice, um, early on in after surgery, I would say after the first 2, 3 weeks, ice is very good to keep the swelling down. But then after the first 2 or 3 weeks, like most injuries, sometimes it's better to use heat. And what the heat does is bring more circulation to the area. As we talk about winter joint pain, if you put cold ice onto a extremity, it's going to cut off the blood supply. So when it cuts off the blood supply, the swelling goes down. But a few weeks later, once the swelling goes down on its own, sometimes it's better to bring more blood to where it wants to heal. So bringing heat to an area that just had surgery can be valuable to increase the blood supply so you can heal faster. So in my practice, I say if you have an injury, ice is good for the first two weeks. After that, you can do whatever is more comfortable with you. If you come to physical therapy, what they normally do is they give you a little heat to warm you up, and they may ice you down at the end to get the swelling down. Next question is any recommendations for managing rheumatoid arthritis? Well, that's a very complicated question because there's a whole specialty called rheumatoid. Um, the rheumatologist takes care of rheumatoid arthritis. So, for those that don't know, rheumatoid arthritis is the study of how the body works with its immune system. And rheumatoid arthritis is actually any arthritis in which your own body is attacking your joints. So it's an autoimmune disease. It's your own immune system that is attacking your joints. So there are a lot of treatments for that. And it starts out with the anti-inflammatories like Motrin and Advil, and can go all the way up to these new medications you see advertised on TV that change your immune response to your own body. But that is something that you need to talk to with your doctor, whether it's your rheumatologist, your primary care doctor, or your orthopedist. But it's a very, very good question, and there's a lot of new medications out there. This is not a question. PT says, thanks for pushing the exercise component. Yeah, motion is very important. Everybody knows if you sit around too much, you're going to get stiff. And one of the reasons why people don't do as well in the wintertime is they tend to be much more sedentary. When it's nice out, everybody wants to walk outside. In the wintertime, we want to hide underneath our blanket. So it's very important to move around. And again, on that, what's a good treatment for medication for knee stiffness? Really, if your knees are stiff, to exercise your knees and stretch them out is very important. Keep it loose. If you keep your knee not moving, it's going to get more stiff. And then if you want to talk about a medication, it's probably anti-inflammatory again, like Motrin or Advil. Any
All
other
right.
questions?
Yeah, we'll wait a minute, see if anybody else is typing in the chat. Like I said, if anyone wants to unmute and ask the question, feel free.
I have a
Just thanks for the
question.
compliment for the PT.
I have a question. I have had a shoulder replaced, a knee replaced, and my foot's had a bunch of surgeries. So they click a lot. It's not painful, but is that an issue? I typically
Clicking is
ignore
pretty
it.
normal.
Okay.
I tell all my patients, especially with knee replacements, they click. And they click all the time because it's a mechanical device. When the metal separates from the plastic and comes back together, it gives this hard clicking or knocking sound. It's something you may or may not hear, but it's something that a lot of patients feel and then the people next to them can't hear. Typically, shoulders and hip click less, but knees are notoriously bad for making a lot of noise. And that's normal. If it doesn't hurt you, it's perfectly acceptable to have clicking in your joints, artificial joints.
All right. Any final questions? Just want to make sure there's no slow typers out there. That would be me taking 10 minutes to type one sentence. Anybody else want to unmute? If not, we may be wrapping up early.
Well, I
All
want to
right.
say thank you, Savannah, for hosting and putting this all together. It takes a lot of work behind the scenes. We run these chats all the time. If anybody has any questions, reach out to our marketing team. Seaview Orthopedics is always here to help you out with any of your aches and pains and orthopedic issues. We take care of all the body parts. I specialize mostly in hip and knee replacements, but we have everything from, like you said, concussion management, back pain, neck pain. We take care of children with 3 full-time pediatric orthopedic doctors. So thank you very much for joining us tonight, and thank you for your attention.
Dr. Mark,
Yes.
I have a question for you. After hip replacement, several years after hip replacement, what could possibly be causing a pain down the front of the leg?
So there's a number of things it could be. The common things, are that it's not really related to your hip. As people get older, some people get back problems. Spinal stenosis is very commonly gives you pain very symmetrically down the front of both thighs, and people mistaking that for hip pain. Also, people that have had hip replacements for a long period of time, sometimes the bone thickens and can give you some bony pain. So, if you're still having trouble, it's not unreasonable. Come in and get an X-ray just to make sure your joint replacements are functioning fine. The good news is modern day hip and knee replacements should last 30 years. They don't wear out anymore. So as long as you don't, have a major issue, they should last you pretty much 30, 40 years without any problems.
Okay, thanks. I'll probably see you.
Okay.
All right. So thank you so much, Dr. Mark. Thank you for the little shout out at the end. I appreciate it.
Thank you.
So in case anybody missed my little spiel in the beginning, I do just want to let you know that we host these every other month with different physicians in our practice. So we're going to be announcing another one for April within like the next probably couple weeks. If you want to stay up to date on all of that, you can visit our website, www.cvuortho.com. We have an events tab right on the homepage. We also are on all socials, Facebook, Instagram, YouTube, TikTok. We are at Seaview Ortho. And you can also listen to our podcast, the Seaview Ortho podcast, on Instagram. You can listen on any pretty much platform that you can listen to podcasts on. And you can sign up for our newsletter if you scroll to the very bottom of our website and enter your email address. So if you did hop in late, if you want to rewatch or you want to share any of this with a friend, the link to the recording is going to be sent to your email at some point before the end of the week. So keep an eye out for that. Dr. Mark sees patients in our Brick, Freehold, and Ocean offices. So if you'd like to set up an appointment, you can do so by calling 732-660-6200. Or you can use our online booking tool. We have a little chat bot that can help you out right on the bottom right corner of our homepage. So thank you all again for spending your Tuesday night with us. We really appreciate it. And we hope you have a wonderful evening.
Thank you.
Thank you much, everybody. Have a good night.